Cholesterol is an organic compound belonging to the lipid family, necessary for the correct functioning of the body, as it performs important functions. Among these, we find participating in the synthesis of some hormones, such as testosterone and cortisol, but also vitamin D and bile acids, as well as being an essential component of cell membranes and the myelin sheath. However, when cholesterol levels in the blood increase, it begins to deposit along the walls of the arteries of the blood vessels, forming plaques, which, in addition to reducing the elasticity and resistance of the affected arteries, can grow over time and cause partial or complete blockages. This can lead to a number of serious medical conditions, which can even be fatal, such as a myocardial infarction or stroke. Approximately 80% of the cholesterol present in the body is endogenous in nature, as it is produced by the liver, while the remaining part is introduced into the body through nutrition. In most cases, hypercholesterolemia is the consequence of an unbalanced diet, generally particularly rich in saturated fats. To naturally lower blood cholesterol levels, there are some foods that come to our aid. But what are they? Let's go see them. Legumes. Rich in vegetable proteins, fibers, vitamins, and essential minerals, legumes are a set of edible plant seeds belonging to the Leguminosa family. Due to their excellent nutritional properties and their low environmental impact, which favors more sustainable agriculture, legumes are considered the food of the future. Among the best-known ones, we find beans, lentils, chickpeas, and peas, but also broad beans, soya, lupins, and peanuts. Observational epidemiological studies have associated legume consumption with a lower risk of coronary heart disease and have been shown to reduce total cholesterol and bad cholesterol in clinical trials. According to the researchers, soluble fiber in particular, by binding to bile acids in the intestine, prevents their reabsorption in the body and promotes their fecal excretion. As a result, the body replaces lost bile acids by removing cholesterol from the blood to produce new ones within the liver. The result will be a decrease in cholesterol levels. There are also other phytochemicals that can contribute to the cholesterol-lowering effects of legumes. For example, it has been shown that phytosterols, a component of plant cell membranes, reduce cholesterol levels in the blood. Researchers at St. Michael's Hospital in Toronto, Canada, have discovered that consuming a portion of legumes a day of around 130 grams is enough to lower bad cholesterol by 5%. This would result in a 5 or 6% reduction in the risk of heart disease. Nuts. Covered with a hard and inedible shell, nuts are a collection of seeds produced by different species of plants. Among these we find walnuts, almonds, hazelnuts, pistachios, cashews, and pine nuts. Source of proteins, good fats, vitamins, minerals, and antioxidants, nuts bring a series of benefits to the body, promoting general health, particularly cardiovascular health. Consumption of nuts lowers total cholesterol, bad cholesterol, and triglycerides, and the extent of the effects appears to be due more to the quantity consumed than to the type of nut. The cholesterol-lowering effects of nuts are mainly attributed to the high presence of monounsaturated and polyunsaturated fats, commonly defined as good fats, as they help lower blood pressure and improve heart health, thus combating heart disease. Based on a systematic review conducted by researchers at the University of Nablus in Palestine, almonds, walnuts, and peanuts, even if in reality the latter are legumes, exert beneficial effects mainly on cholesterol and bad cholesterol, while hazelnuts, pistachios, and walnuts have a beneficial effect, especially on good cholesterol. International dietary guidelines recommend consuming 30 grams of nuts per day, perhaps including it at breakfast and in snacks, for example, adding it to yogurt, but also to salads, soups, or pasta dishes. Avocado. With a delicate flavor and with a soft and creamy pulp enclosed in a rough dark green skin, the avocado is an exotic fruit originating from Mexico, where it was cultivated thousands of years ago by the Aztecs. Avocado is a very versatile ingredient in the kitchen, as it can be used in different recipes, from salads to toast and tortillas, from guacamole sauce to the preparation of first and second courses, as well as numerous desserts. An avocado a day combined with a healthy diet would help keep bad cholesterol under control. This is the result of a study conducted by a team of researchers from Pennsylvania State University who studied the effects of consuming this exotic fruit on a sample of 45 overweight or obese individuals. The daily intake of avocado has been associated with a reduction in those smaller and denser particles that make up bad cholesterol, and which, due to an excess of free radicals, have been oxidized. These oxidized low-density lipoproteins, as well as being cytotoxic for endothelial cells, play a primary role in the formation of atherosclerotic plaques, and therefore in promoting the onset of cardiovascular diseases. Oats. Belonging to the Gramineae family and native to the distant territories of Asia Minor, Avena sativa is an annual herbaceous plant whose fruits appear in the form of small ovoid-shaped grains. Rich in dietary fiber, proteins, vitamins, and minerals, oats are a precious cereal for the well-being of the body, in particular for its hypocholesterolemic and hypoglycemic properties. The dietary fibers present in oats, through their fermentation by the intestinal microbiota, can influence cholesterol metabolism by acting on bile acids and influencing the absorption of lipids. Beta-glucan in particular, soluble dietary fiber found naturally in oats, has been shown to significantly lower serum levels of total cholesterol and bad cholesterol. For this reason, the Food and Drug Administration and the European Food Safety Authority have authorized the use of health claims placed on oat-based products where the hypoglycemic action of beta-glucans is remembered. The intake of at least 3 grams per day of beta-glucans lowers serum levels of total cholesterol by 5 to 10%, and those of bad cholesterol by 7% compared to basal levels. However, not all oat-based products seem to bring the same health benefits. This is due to the manufacturing processes that this cereal undergoes, as they can alter its properties and therefore the quantity of beta-glucan. Whole oat products are more effective in lowering cholesterol than refined ones, where precious vitamins, fibers, and other nutrients contained in the seeds are lost. In conclusion, we have seen how nutrition plays an important role in maintaining optimal cholesterol levels and consequently in the prevention of cardiovascular diseases such as myocardial infarction and cerebrovascular diseases such as ischemic and hemorrhagic stroke.